live between New Jersey and France. I'm here with Dr. Michel Rouif, who is a member of SOFCEP, a chairman of the International Committee of ASAPs, and a secretary assistant for ISAPs in France, along with being an esteemed affiliate partner of the Aesthetic Surgery Journal. Welcome, Dr. Rouif.
Thank you. Thank you, Fedra, for your invitation.
Thank you so much for joining us. So we're here to do the next installment of our International Spotlight program, where we highlight hot topics globally. I'm sure you've heard and are dealing with this in your own practice and experience about some of the issues relating to fat grafting, with some of the deaths and incidents with gluteal augmentation. So in your practice, Dr. Rouif, are you seeing an increase in fat grafting patients for facial contouring, breast, buttocks? What are you seeing in France?
So I think in France we did a lot for breast. Emmanuel Delay did a lot, and so we are very interested in all this practice of fat grafting for breast reconstruction and aesthetic also, and also for modeling the face. It's very nice. And now, as you told, for buttocks, with the problem of safety with buttocks, because it's a big topic now in our meetings to explain why we have this problem about buttocks, which is a different fat grafting. So now we know that we have different type of fat grafting for face, for eyelids, which is micro. We speak also about nano. This is different. So macro, micro, fat for the breast, fat for the buttocks. It's not the same topic. Really different families now of devices we use, of the amount of fat we put in, and also, what is the most important for me, about the shape. Because everything is in volume and shape. And we can do very nice things if we are artists in a way, and we can do bad things if we're not understanding what are the volume of the young people, of the old people, how it achieves, and so. So it's a new field, fantastic field. It's in the heart of aesthetic also, I'm sure.
So this is a great segue to how do you counsel your patients? Obviously, different sizes and shapes, different techniques, and for the different procedures. How do you counsel them, and what questions are you hearing from patients who may have seen what's happening in the media, example, gluteal augmentation? How do you work around that as a practicing aesthetic surgeon?
As I told you, I would say it's different for face, breast, and buttocks. For face, we have to manage with aging. So we have to explain it's not only pulling, lifting, it's about volume and also pulling or putting things in the right place. So we have to discuss about the volume and the right places for the volume. So, and we have to discuss also for the eyelids, because they know that in the past we had some problem with nodes or something like this. So we have to explain fat is important and facelift also is important, and both of together, that's perfect. So we have to explain that. Of course, it's more time consuming, so it's a term of price also. For the breast, very interesting for asymmetry, but you have to explain projection of the breast is different with the shape. So I like the idea of breast implant plus fat grafting. So we have to explain that. Breast implants they have advantages, and also fat is nice for camouflage, or also for improve the shape. For asymmetry, that's perfect. And for the buttocks, this is another topic, because you have this problem of safety. So and we don't have in France too much this phantasm or this trend they have in the US about Kardashian buttocks. We don't like that too much. For the French stuff, it's not the way we want to have. So in summary, I have to explain to the patients advantages of volume in the right place and what we want to do, and also the weight. We have to explain the problem of the weight. So if you don't explain to the patients that the fat grafting are, as said, numerous, this is not bone, this is fat, it's something which is moving with the weight, which is changing with the weight. If we don't explain that, they can be disappointed in the future, because if they lose weight, they will lose this volume they got after the surgery. So it's more dynamic with life. That's fantastic, but that's not implants. So you don't have to change, but you have to understand that things can change during the life, so with the weight. And so I focus a lot on the weight.
So you mentioned breast augmentation and implants. In light of everything happening with BIA ALCL, are people coming in and asking for smooth versus textured? What are you seeing in regard to that?
So we are not too much asked about the texture or smooth implants. I think we do that in France. Spontaneously, we're just explaining that there is some things coming in the media about textured implant, but we don't want to increase too much this noise because it's rare, it's really extremely rare. So we don't want to not to explain, but of course we have just to say, please don't make the mistake to say we don't want implant on fat because of a CL. So we try to just explain that's possible, but we explain to you, but fat is not at the place of the implants. This is something implant is has advantages, and don't mix everything. So try to understand that breast implants, silicone breast implants are good. If you want smooth, you can make smooth. One texture can be section. The trend is maybe to have more smooth and round, maybe, and shape with the fat. It could be something which is nice because it's perfect. And so, but I'm not scared about the texture. Maybe more micro because. Okay, you know, right.
Sure, I think that's kind of the common consensus. So
Yeah.
what other trends are you seeing? And you talked earlier about safety and precautions. Talk to us a little bit about different trends you're seeing and what additional or new safety procedures you've implemented as a result.
Yeah, so maybe I would like to, the safety for faces could be also about emballism, but this is published, but it's very rare. So I don't speak too much about this. In breast, about safety, it's more about cancer, so about prevention, having a mammogram before and after. So, and of course, the history of the patient and the family about cancer. Finally, for buttocks, this is the big topic, okay? And also the way we manage, we prepare the fat, because the closed system are really in the trend also. So maybe having some filters, some like devices like pure graft or this kind of devices. That's the idea to create something which is more closed, a closed system, and also not too much manipulations because of infections. So for buttocks, it's a topic. It's a little bit different with face and breast. You have more fat, more manipulations, so more we need more closed systems. So this is the thing I want to improve my practice is the way we prepare the fat for buttocks, and also the amount, because this is a big question. How some of colleagues in the US, like Daniel Del Vecchio or Mendieta, so they put a lot. So that's a big question. So, but prepare the fat is also a big topic.
So, last question for you. What advice would you give to the trainees? I know you have 60 some odd trainees at SOFCEP. What advice would you come to trainees coming into this world, thinking about fat grafting and the different ways to manipulate, the fat, prepare the fat, inject the fat, how to do it, how many layers deep? What advice would you give as a rule of thumb to help guide this next generation?
So I would say once more, 3 families. For the face, don't overcorrect, but think of the volume, which is important, not only pulling the tissues. So for the youngest is that, and for the eyelids, I do a lot of fat grafting for eyelids. Try really to think about the way you prepare your fat, because you need something very smooth, not to have this kind of nodes we had in the past. So imagine the face, think about the art of the face, the shape of the face. Don't do too much everywhere. That's so horrible, That's something important. It's like for fillers. Think about the volumes of the face. Don't do too much, please, at first. So, and say to the patient, the topic of the weight, and so they explain that to the patients, and don't do too much, but think about the volumes of the face, your own face, or the face, and so. For the breast, don't put too much, and of course, be sure that there is no problem with cancer. And for the buttocks, don't say to the patients, I'm going to make a very nice buttocks only with fat because it's the trend. So explain to the patients that they have to think about the volume, what kind of shape they want, but we cannot inject too much at the beginning when you're a young surgeon. I think it's not easy. So don't promise too much about the fat grafting, and think about the volume. And of course, when you overcorrect, it's not easy after to solve the problem. So for the face especially, but also for breast or for buttocks. So don't overcorrect on the face, but even on the breast and buttocks too much. So maybe it's fantastic to think about this. This is a big field for aesthetic surgery. This is really something fantastic.
Absolutely.
And also, there's another topic we didn't speak about. It's about PRP or stem cells or this new facelifts with PRP or with stem cells, which are super facelifts. I don't understand that. We need proof. In France, Professor Megalon did a lot. He tried to just explain how it works with all these new trends, but there's some problem with the marketing also. So we need science, and so the youngest are always with enthusiasm. That's fantastic, but just be serious, and so think about science.
So it sounds like managing expectations of the patients is important. Trainees working within their experience level, and then bringing more evidence-based research like we do here at ASJ to the literature, so practicing physicians like you can make good choices and have good results and have safe patients.
Yeah, we could say that. It's totally in the heart of aesthetic surgery. Science and also art, not only the medical art, but also, I'm used to say we're more handcrafted than artists. But I would say, think about the shape. We need to keep the shape in mind. All the people like our friends in Colombia, I'm sorry, I'm just missing his name. And so it's just explaining the shape of the muscles. And so we have to study the muscles, the shape. So don't make this shape which are not natural. It's not. Vallombros showed you this face, round face, and he said they are losing their personalities. The twins, you can change the face. The person is not the same. So it's sad to overcorrect. Think about this. This is a new field, a field of art, specifically the art of aesthetic surgery. Yes, science and also shape, art, artistic things. So that's nice. Fantastic field for aesthetic surgery.
I think I know a book of that exact title, The Art of Aesthetic Surgery. Well, Dr. Rouif, thank you. It's been a pleasure and very insightful. We so very much appreciate all of your continued support and being with us today. Thank you.
Thank you so much, Eva.